The pumping action of the heart creates a definite pressure on the cardiac muscles, forming the heart wall, which causes the blood to flow through the arteries. This is called as blood pressure, popularly known as BP. Cardiac muscles forming the heart wall contract to push out the blood from its chamber to a great artery called aorta, while cardiac muscles relax to receive the blood from great veins called inferior and superior vena cava. This contraction and relaxation of heart chambers respectively gives rise to systolic and diastolic pressure within the wall. Systolic pressure indicates the pressure that the heart generates to pump blood to the rest of the body, whereas diastolic pressure refers to the pressure in the blood vessels between heartbeats. Blood pressure is expressed in two separate figures. The first indicates systolic pressure and the second diastolic. It is known that systolic pressure increases as we grow old, while diastolic pressure begins to decline after 60 years. Things first. Let us know the criteria to term our blood pressure as hypertension. For an individual, systolic blood pressure measuring 140 millimeters of mercury or greater and diastolic blood pressure measuring 90 millimeters of mercury or greater can be referred to as hypertension. Higher level than this is alarming and should be paid immediate attention. Ignoring it increases the risk of various health complications. Blood pressure is measured with sphygmomanometer. Pressure cuff is applied to the arm, and the cuff pressure just above where the arterial pulsation at wrist disappears is slowly increased. This marks the time when artery is made to collapse temporarily by manual pressure. Then pressure is slowly released to listen to the typical sound produced with the help of a stethoscope. Appearance and disappearance of this sound helps to assess systolic and diastolic pressure. Many a times hypertension is latent. You may not have any symptoms and it may go unnoticed for years. But watch out! Symptoms such as headaches, dizziness, fatigue, and ringing in the ears may be due to hypertension.